As abortion rights dominate the current U.S. election cycle, many Canadians believe lawmakers here at home can do a better job securing safe access to abortions. And you can add the federal NDP to that list, calling for better and expanded access. To talk more about the issue is federal NDP leader Jagmeet Singh, the party's women and gender equality critic Leah Gazan. Thank you so much both for being with us here today. We were just together last week, so thank you for rejoining us for this important conversation. You know, we've been seeing the issue of Roe v. Wade happening in the U.S., and that really highlighted the issue here in Canada as well. I think most Canadians would figure the right to abortion is settled law here in Canada. Does your party feel that abortion is under threat in our country?
Yes, we actually are very concerned about it. One is we know we've got a right, but the access to that right is something that we're seeing actually a big reduction over the past number of years. We're seeing less access. So the right is only as powerful as access to that right. And if the ability for people to access abortion services is getting harder and harder, then the right becomes weakened. We also know that with the Conservatives, there is a real threat to the right to choose. We see a recent documentary made by a Canadian filmmaker, Quebec documentary maker, Leah Clermont-Dion. She interviewed one of the former MPs with the Conservatives who said the anti-choice crowd is calling the shots in the Conservative Party. So anti-choice folks have more and more presence. They're campaigning hard. There's real threats to the choice and access that choice in Canada.
You have a motion that's going to be coming up here in Ottawa, but I want to touch a little bit on your conversations with advocates in the community. What have you heard, Leah, and can you walk us through where the gaps in abortion access are at?
Well, I know in Manitoba, for example, the Women's Health Clinic is one of the last standalone places where women and diverse gendered folks can access a safe, trauma-informed abortion care in the country. And, you know, as our leader has indicated, it's one thing to have a right, it's another thing to be able to access that right. In Alberta, for example, Daniel Smith is looking at privatizing the healthcare system, handing it over to a health organization that will not provide either abortion care or emergency contraception care. So, you know, service providers are concerned about it. You know, women and advocates from across the country fought hard to ensure that right, to ensure safe, trauma-informed abortion care, access to all health care. In fact, that is a beacon of the new Democratic Party.
So what does it mean not to have that access? You know, when you're speaking with folks watching here, what does not having that access look like?
Well, do we want to go back to a time where, you know, individuals were having back alley abortion care? You know, there's also cases where it's unsafe for individuals to give birth, life-threatening circumstances. We know in the States, there's cases where, you know, children who've experienced sexual violence, sexual abuse have been forced to give birth. Canada, you know, needs to do better. The Liberal government needs to protect access, and we also need to push against a potential conservative government that is threatening abortion care in the country.
I want to talk a little bit about your motion that's coming up, and I want to quote from you know, your own party here. It's to ensure equal access to publicly funded abortion care across all provinces and territories. Why introduce this motion now? And I'm wondering, are you hoping to get the support of the Liberals?
Well, we want to push the government to acknowledge that access has gotten worse. So one of the examples Leah was talking about, the different provinces, we now find that for 1 in 5 women, the nearest center, if you want to go to an abortion service or access abortion services, is more than 100 kilometers away. So that's a significant part of our population where that's not accessible. And then that's not even to mention Indigenous communities where the access is even worse. So we want to acknowledge that in Canada, access is a serious problem. And so we're calling for emergency urgent action to improve access. In New Brunswick, for example, the last abortion clinic shut down because of a lack of funding. That's where the federal government could have stepped in and said, you know what, you've got to enforce the Canada Health Act, the law that says all public care should be funded properly. And as Leah mentioned, this is a part of our public healthcare system. We don't separate this at all.
Are you in touch with your Liberal counterparts? I'm just wondering where that relationship is in order for this motion to kind of be adopted.
Well, we've raised this issue. We've made the announcement that we want to see support for it. We encourage people that are listening, let your local MP know that you want them to vote in favor of this motion. It's acknowledging that access has gone down and that we need emergency action, like quick action to improve access right away.
Are you on speaking terms with Justin Trudeau?
Well, we've put these ideas out in the public, and we know that the Liberals know where we stand on it, and so we want to now challenge them to step up. They've been in power for 9 years, and access has gotten worse in those 9 years. They haven't used the tools they have to force provinces to make sure they deliver public health care. So we're going to put that on the table now. Look, there is a motion calling for immediate action. Will you support it or not?
Okay. Jagmeet Singh, Leah Gazan, thank you so much for coming here. We appreciate it.
Thanks so much.
Thanks for having us.